Okay, welcome to the Davies Use Case webinar being presented by Gnomes Healthcare on increased access. This is a Davies Award-winning use case for the value of health IT. My name is Arnold Simmons. I'm the Manager of Quality and Patient Safety, and it's my pleasure to moderate this presentation. Core to the HIMSS mission is promoting the use of health IT to improve the quality of healthcare delivery. HIMSS promotes and advocates the integration of clinical decision support and best practice guidance, access to clinical data to analyze progress, and IT-enabled patient safety tools for all healthcare organizations, clinicians, patients, and community members as vehicles for improving patients' outcomes. The HIMSS Nicholas E. Davies Award of Excellence is the pinnacle of the HIMSS Value Recognition Program. The Davies Award recognizing achievement of organizations from around the world who have utilized health information technology to improve patient outcomes and value. The Davies Awards winning use cases have been peer-reviewed to validate sustainable, improved patient and business outcomes resulting from health IT-enabled care delivery. Welcome our speakers for today's webinar, and we welcome Missy Thomas and Dr. Jennifer Holman. And so I'm going to turn this presentation over to you all. And
good morning on behalf of Gnomes Healthcare. My name is Missy Thomas. I've been years. I began my career as a receptionist. 3 years later, I joined the IT team as an analyst and was promoted to IT director in April of 2015. Most recently, transferring roles to the IT project director in November of 2016. Josh joined Gnomes in March of 2007 as director of finance. Josh has served Gnomes as CFO and COO. And promoted to CEO. In this role, he effectively doubled the size of our organization in less than 20 months. Executive Vice President of Gnomes Healthcare. Dr. Healthcare in 2010. Dr. Certified physician whom specializes in family medicine and aesthetics. Along with filling the role of Executive Vice President, she is also our PCMH clinician lead, our provider EHR super user, as well as the co-chairman of the Standardization Implementation Committee. President of Population Health. Career has been spent in the nursing field with over 15 years practicing as a family nurse practitioner. And to join Gnomes Healthcare as Vice President of Population Health, overseeing or also care organization of the organization to promote the transformation of healthcare delivery. Holly management. Holly Gnomes Healthcare 10 years ago as a nurse. In 2000, Holly was promoted to Director of Care Management. And the care team over the last 2 years. The care team began with 2 team members, herself and a social worker, and has grown to 26 of RNs, LPNs, social medical assistants, and a dietitian. Stephanie, clinical IT analyst. Stephanie of Gnomes for 3.5 years. Stephanie's role here at Gnomes includes building and modifying reports, creating registries, interface mapping, and ensuring the quality data extracted from our EHR is validated. Organization in Northern Ohio serving 7 counties with 186 providers and 55 office locations. No care to an average of 1,132 appointments a day. Healthcare. The mission of Nomes Healthcare is to provide excellent, personalized, team-based care. And in 2001, Northern Ohio Medical Specialists was formed with 32 physicians. Physicians formed an information technology, or IT, committee to explore converting from paper charts to an electronic medical record platform. The newly formed IT department began implementing. Nomes received NCQA Level 3 PCMH recognition. And two, chronic care management team, Nomes 360 was instituted. In 2013, Nomes Healthcare was recognized as advanced pay ACOs across the nation. In 2000, granted CPC Plus designation for all of our well-established practices. Here's employees. Nomes from the electronic access that we currently have shows that in 2012, Nomes had 261 employees. Today, the Nomes team consists of 646 team members. And at our trend, we will continue to reflect our growth at this rate. Began with 32 providers. We have seen an increase in providers with the biggest jump within the last couple years, more than doubling our provider count. 69 providers, and today in 2017 we have 186 total providers. Increased access. When Nomes Healthcare began the patient-centered medical home PCMH journey, we recognized the need to increase our provider access. Our first third report revealed that appointments were not always available within the 24-hour time frame as required by PCMH guidelines. What exactly is a first third available appointment? This is the next open appointment the provider has available on his or her schedule. The daily to accommodate the patient's request for a same-day appointment for a routine or urgent care need. In 2013, we found that more than 75% of our office did not have this availability within the 24-hour time frame. We again utilized IT to assist in a workflow that would allow for provider access. Prior, we were all manually tracked by utilizing staff to perform ghost calls to offices asking for their next available open appointment. Today, we have a report built in ECW that objectively pulls this data for us. 100% of our providers are compliant and have same-day appointments available for sick and chronic appointments. We'll be reviewing with you the steps taken to increase our provider access in an effective and efficient manner, along with the intervention and implementation used. And the value derived from increasing our providers' access to the patient. Our 3 same-day acute visit appointment slots to all providers' daily schedules. Sick appointments as well as same-day chronic appointments. We monitor for same-day scheduling. And 2, Nomes Urgent Care Sheffield was opened. At each office location. In 2016, we had extended office hours, and in May 2016, we instituted HELO, This allows the patients the opportunity to request an appointment anytime, anywhere. And open access was opened at 3 locations. You can see that we templated our schedules by our analyst for all providers, which carved out the same-day acute visit appointment slots, and those are the light blue turquoise colored appointments. In order to aid in the increase of provider access, we found that we needed to increase our provider availability at the office level. Therefore, we began to recruit advanced practitioners to fill the void. This was just one way we increased our access to our patients. In 2014, we had 26 advanced practitioners, and today we have 41. We found that we needed to expand our office hours to include evenings and weekends to accommodate our patient population. And 2% of our offices were open evening hours. 8 have extended hours available. 40% of our offices are open late every evening and also have Saturday hours. 13% of our offices are open 2 evenings or more a week. 47% of our offices do not have extended evening hours. However, all NOMS healthcare offices participate in our NOMS Open Access. And I'll describe NOMS Open Access here in the next few slides. There are ways to request an appointment outside of normal office hours. There's no more waiting till the office opens the next morning to request an appointment. Patients can request an appointment anywhere, anytime. Patients, along with the reason the visit is needed, and click Send Request from either their computer, tablet, or smartphone. This is the appropriate designated staff for that specific office. Upon the staff member then logs in for the first time. He or she receives these requests and completes these immediately. Send a response message to the patient electronically with their appointment day and time, or they can elect to call the patient. User-friendly and guides patients to the necessary pages at the click of a button. To request an appointment, all you need to do is click the appointment icon on our home page. There is a provider. User-friendly and guides the patients to the required information needed to make the request. Here's what the iPhone app looks like from the patient side. The appointment icon, you click the provider. Acute NOMS patients. Offers extended hours, including Saturdays. Like I said, we have multiple locations. All access schedule. If their schedule is full for the day and a patient needs to be seen, they can pull up the open access schedule and place them in one of the 3 open access locations. This is the patient within NOMS. Like I said, patients are permitted to utilize the open access. All access to the open access schedule, every patient's medical record. Our line rings in all of our providers' offices. So should an office close early, all offices can cover each other's phones. The PCP once the patient is seen. We'll focus on our Sandusky location here. 2 evenings a week, open 2.5 hours each evening and 3 hours on Saturday. In June of 2016, we opened. We found that in October of 2016, we increased that access to 5 evenings a week from 5:30 to 8 p.m. and on Saturdays from 9 a.m. to 2 p.m. 2017, we again increased our access. We are open Monday through Friday from 12 p.m. to 8 p.m. and Saturdays 9 a.m. to 2 p.m. Here's the number of patient visits after 5 p.m. weekdays and also including our Saturday office hours. And we have 2 locations that offered minimal extended hours. After closely monitoring our emergency department utilization reports and considering patient feedback, we increased that number to 7 locations in 2016 with Monday through Friday evening hours, including Saturdays. So any problems filling those after-hours appointments means that we treated 10 times as many after-hour patients in 2016 as we did in 2015. Locations, we had 4,149 appointments, and in 2016, we had 7 locations. We had 40,420 appointments. All of NOM's open access locations from 2016, we discovered the 40,420 visits came through. 120 visits alone seen at NOM's at a cost of $70 a visit generated $2.8 million. 20 visits been seen at the emergency room at a cost of $2,100 per visit. Average ED cost from our claims data, which would have cost the system a total of $84.8 million. You can see the cost to payers could have been substantially higher had we not increased our access. Increases for all of our open access locations. Let's focus on this one location. Here you can see the total number of monthly overflow visits that were seen at the one Sandusky location. The number of visits seen at this location allowed for us to justify the increase of office hours at this one location. We decreased the cost to the patient. An average emergency room copay is $100, where the average emergency room charges are $1,200. Which we created in our schedules. We extended our hours. We instituted HELO open access. We provide lunch and learn staff trainings. We have provider templated schedules, and we've created and ran reports. Increased patient satisfaction scores. We've ensured our patients receive the right care at the right time and place, all the while decreasing overall out-of-pocket costs to the patient. Like we said, in an average visit copay versus an ER copay, $20 and $100 respectively. We can an average office visit versus an ER visit, $70 and $2,108 respectively. Surveys are based on a scale of 1 to 5, with 1 being dissatisfied and 5 being extremely satisfied. These are a few questions that relate to the provider access. So, an appointment for a checkup or routine care with this provider, how often did you get an appointment as soon as you needed? So in 2000, the average was 4.72, and our increase in 2017, we're at 4.77.
Is that our patients will receive the right care at the right time, and if done right, most of that time will be with our PCPs and not in the emergency department. This graph provides a visual using quarterly utilization and expenditure reports from CMS that show a downward trend in our ED utilization. We hope to continue to see the decrease below our payers. We are the blue line, and the other ACOs and fee-for-service will payers lines. So you can see we had a lot of room for improvement, and we continue to trend downward, even when some of the other organizations are trending up. feeds from Medicare to evaluate the cost and utilization of the care of our patient panel. A quarterly provider analysis report is generated that gives providers insight to their patients' ED utilization. The rate is normalized from the data so that providers can be compared. The is the percent of visits that could have been treated by a PCP in their office. They also demonstrate the most common day providers day provides an insight as to when an office or provider may need additional help. For example, an additional NP or PA or other provider in the office. The claim an average cost of the ED visit during this time frame, which is around $1,900. Knowing that the number of preventable visits, we can estimate how much our expenditures could have been avoided, saving healthcare dollars. This chart was published Q1 2016, and the next slide for comparison. The average cost of the ED visit at this time is $2,100. So our avoidable $9 million if we would have prevented 100% of ED avoidable visits. If we would just save 25% of those visits from going to the ED, we could have saved healthcare dollars of $2.4 million. So no 1,000 has decreased from 2016 to 1,257 to 870. To prevent 100% of avoidable ED visits, we could have saved CMS $11.5 million in 2016, and we decreased that potential to $9.7 million in 2017. By increasing access to our PCPs with extended hours, and next third, we continue to trend downward on our preventable ED visits and our ED per 1,000 rates, 1.8 million.
So with all of our new initiatives we have on our roadmap, it's going to require us to utilize our information technology to its greatest potential. So future goals for Nome's Healthcare, we're going to continue to increase our access. Some ways we're going to do that is we're going to offer telemedicine. This is currently available through ECW. We plan to pilot this program to our family practice offices in the fourth quarter of this year. We're going to begin to offer more than traditional face-to-face visits with our patients and providers. Provider network. We're anticipated to double in size. We're going to decrease costs by utilizing our ancillary services within our organization. Nome's lab and imaging centers opened the fall of 2017. Urgent care and open access is expanding to our eastern market, first quarter of 2018. At Nome's has been fourfold and evaluated with these criteria in mind. Staff containing the cost, all care, and lastly, keeping provider satisfaction in mind.
Thank you for another great presentation. Want to remind folks where to go find more Davies use case webinars and more information on how to apply for the Davies Award. And this information can be found at the HIMSS Davies Award website at hims.org/Davies. Once again, thank you for the great presentation.